Hi, my name is Andrea Wolf, and I will be presenting my master's thesis at Colorado Christian University. My master's thesis is entitled, Is Dental Organizational Leadership Associated with a Dental Workforce Shortage? Prior to conducting my research, I had 3 questions that I was very curious to answer. The first is a lack of effective leadership causing professionals to leave the field and dentistry? Number 2, is there adequate training for dental organizational owners in how to lead a healthcare team? And if so, where does it happen? Number 3, what is the best style of leadership in a healthcare setting? Is one shown to be better than the other for healthcare workers, specifically in dental organizations? So there is currently a nationwide dental hygiene and dental assisting shortage in America. Currently, 1 in 3 dental offices are saying it is extremely difficult to hire a hygienist from a 2022 research report. Research from a 2023 report shows that 1 in 3, the top 3 reasons for healthcare workers leaving the field are related to burnout. Burnout has to do with feeling exhausted, inefficient, and unmotivated. The American Dental Association and the American Dental Hygiene Association, along with the American Dental Assisting Association, conducted a very interesting research study in 2022. They sent a survey out to 1,800 dental auxiliary, asking if they're still working, why they're working, what they like about their job, and also why they're leaving and what their reasons are for leaving. The reasons for leaving the field were very interesting. The top 3 were pretty much the same, but just in different orders for hygienists and for assistants. The top 3 reasons were there was a lack of growth opportunity, they were overworked and underpaid, and there was a toxic work environment. Now, as I guess I would find, transformational leadership is highly associated. There's a positive association with worker happiness in healthcare. And transactional leadership and laissez-faire leadership have a direct negative association with healthcare worker well-being. I had a feeling I would find this. I was happy to find it because it does justify and bring clarity to what the problem is and what the solution can be to help the dental healthcare organizations right now that are struggling. So I performed a meta-analysis. I collected data from many different peer-reviewed research studies and journals and dental journals and medical journals and published research. The biggest takeaway for me from this research was that participant style decision-making and leadership, which is associated with transformational leadership, had the strongest correlation with workers feeling dissatisfied. Meaning, if a healthcare worker was not involved in the decision-making, it was almost 100% they were not satisfied with their job. And this can be in the day-to-day patient care and how they get to treat their patients. And this was with nurses and doctors. It was a direct care patient research, so it can be related and transferred over to and be applied to my master's thesis of dental organizations. The limit to this research is that dental organizational leadership has not been researched very much. 2020, I did find this amazing meta-analysis from I believe it was a few different doctors, and they have researched dental leadership, and their conclusion, as well as mine, is that we need to have more research studies on dental leadership and what is best for dental organizations when it comes to leadership. So I performed a meta-analysis to help policy leaders and find solutions to the current major healthcare problem that we're finding ourselves in. It actually is a healthcare access crisis because many patients are not able to have their dental health prioritized due to the lack of auxiliary to hire. Now, there are a lot of different assumptions out there, but I really wanted to dive deep into leadership. So my results indicate that Participant-style leadership, like I mentioned, had a high positive association with nurses reporting burnout. My other finding that is very informative and important for finding a solution is that collective, transformational, ethical, and servant leadership, all relational styles of leadership, were found to be positively associated with nurses reporting well-being at work. Another research study revealed that doctors that did not treat nurses as peers or colleagues, these nurses reported higher feelings of burnout. Transformational and collective leadership styles have been researched as being able to bring employee happiness and worker well-being because they're authentic, they're relational, they're open, they're ethical, and they're engaging and empowering leadership styles. They bring the team in, they are collaborative, they are individualized, they are personal. One of the points I made in my master's thesis paper is that dental workers go into the field because they are social, relational, compassionate, and have a high desire, a high need to help and serve. The current dental model right now is transactional leadership from what research has revealed. Like I said, there's lacking, dental leadership research, but what I have found is that transactional, which is like you get rewarded for doing a task. That is the most dominant that's the most dominant leadership style, as well as top-down, which is, as we know, a very old-fashioned vertical style of leadership, which does not support the leadership science of horizontal leadership being the best style of leadership for worker production and happiness and motivation and feeling like workers belong. Because ideally in this society and today in 2023, workers across the board, healthcare workers and other employees want to feel that they're contributing to something bigger than themselves. They want to feel that they belong. Millennials especially and Gen Zs want to feel like they are a part of something beyond themselves and that they're important and they're special and that they get to be a part of the bigger picture. So all of these things reveal to me that we need to evaluate where are dentists learning leadership, if they only know transactional, and that not being the best from what leadership science tells us. Okay, where is leadership being taught? So I dug deeper into dental leadership in schools, and I found that most dental professors say that there is not adequate leadership training before dentists graduate. And that most dental students want more leadership training. That was a very eye-opening finding for me. As a hygienist that has worked in a dental school and a dental hygiene school in the past, I find that there is a miscommunication and there's a missed opportunity of collaboration. So collaboration, I feel like, is key, and research just backs that up so much. So very little leadership curriculum could be contributing to the dental workforce shortage because dentists do not have time to learn it in dental schools, and then how they go into work, and in the real world it is very difficult to then do something new that you weren't even trained with the value in dental school. And so that was an interesting finding. My conclusion gives me, pretty much the information that I had an idea that I would find, but the main things being that top-down leadership is not conducive to a healthy work environment in 2023, and it's not what employees want. It's not what works best in healthcare settings. It's leading to burnout, and it's leading to hygienists and assistants just not feeling like they are appreciated or valued or part of the day-to-day and patient care. So as I move into the closing of this, I just want to say that leadership is needed, especially as we move into changes in dentistry. Most dental leaders are now looking at dental hygiene leaders as well, because dental hygienists are now able to own their own businesses and own their own practices, depending on the state that you're in. There's still a lack of access to care problem in America in dentistry, so we need change more than ever. We need collaboration more than ever. Leadership science shows us the strength of collaboration, empowerment, and shared decision-making in leadership styles. Dental business leaders must begin to lead now with seeing all their employees as leaders, working in collaboration so that we can bring the solutions needed in 2023 to the dental workforce shortage. Thank you for your time. God bless.